Hi friends, good morning one and all of you. My name is Rasne Somnath, lecturer from Pravara Medical Trust, College of Pharmacy, Shivagaon. My subject is pharmacology and toxicology for second year. Showing the previous lecture, we studied about the drugs acting on the respiratory system. We have to that including about drugs used in bronchial asthma, drugs used in the treatment of cough and nasal decongestant. These points are the cover in drugs acting on respiratory system. So today I am going to discuss with you drugs acting on the central nervous system. There are the one part is remaining or one chapter is remaining for this section. There are the name is the drug dependence and abuse of the drugs. Drug dependence and abuse of drugs. These points are the remaining in the drugs acting on central nervous system. The drugs acting on central nervous system, we previously lecture about shown that we studied about the general anesthetics, hypnotics and sedatives, drugs effective in convulsive disorder, opioid analgesics and antibiotics, antipsychotics drugs, anti-anxiety drugs, antidepressant drugs, centrally nervous system stimulant, centrally acting muscle relaxant, and drugs used in Parkinsonism. All these points are covered in drugs acting on central nervous system unit. But one part is remaining of this central nervous system. There was is drug dependence and abuse of drugs. We will be studied about drug dependence and abuse of drugs. Do definition of drug abuse. What is the meaning of drug abuse? The term drug abuse refers to the use of drugs for purpose other than approved medical and socially use. Drug abuse, these are the drugs, various purpose are the using of the drugs in the society. The drugs are used for the drugs for the purpose of the medical using, but many of the drugs are purpose other than approved medically and socially used drugs, that is called as the this drug called as the drug abuse, or simply misuse of drugs for non-medical purpose, which can lead to acute and chronic toxicity, is defined as also drug abuse. These are the definition of the drug abuse. In that, the drug abuse is having a only term is that the drugs are used for the purpose other than medical, so that's known as drug abuse. Drug abuse it's consisting about the various drugs. Drugs like narcotics are sometimes used indiscriminately, leading to addiction. Various drugs, but drugs like narcotics, these narcotics, it is the substances used to treat moderate to severe pain. These narcotic drug consisting about the morphine, codeine. These narcotic drugs are used for the treatment of the moderate to severe pain. Narcotics are like opiates such as morphine, codeine, but are not made from opium. But these narcotics, these drugs are not made from opium. They bind to opioid receptor. They bind to opioid receptor in central nervous system. These drugs or these narcotic drugs are the binding to the opioid receptor in the body in central nervous system. These drugs like narcotics is sometimes used indiscriminately. What is the meaning of indiscriminately? These are the it's a randomly manner or unsystematically way are leading to the narcotics for the purpose of addiction. That is, these are the drug abuse drugs. Then show next slide. Drug addiction. Drug addiction is a state in which an individual is incapable of maintaining the normal physical and mental functions without the presence of the drugs. Drug addiction or drug addicted person who having the state which having the individual is incapable of maintaining normal physical and mentally function without the presence of drug. We have to that this patient is absence of this drug with administration which having incapable of maintaining the normal physical and mentally functioning, because these drugs are not administration. So this person having to drug addicted or a drug addiction, and to get which having to that maintaining the normal physical and mentally or psychotic functions are maintained well. What is the that meaning of drug addiction? Drug addiction, it's a state, it's a conditions in which individuals that's having only one patients with drug addicted person is incapable, it's having a incapable or incapable of maintaining normal physical or normally working condition and mentally functioning without the presence of drug. These drug having administration in the body so well or maintaining the normal physical and mentally functions. So the expert committee of WHO, the expert committee of World Health Organizations on addiction producing drugs, on addiction producing drug has now replaced the term addictions with drug dependence. The expert committee of World Health Organization on the addiction producing drug has addiction producing drugs like narcotic drugs has now replaced the terms addictions with drug dependence. Drug addiction is replaced with drug dependence by WHO, World Health Organizations. Then next slide show the characteristics of drug dependence are. The characteristics of drug dependence are, its first is an overpowering desire to take the drugs. Second, a tendency to obtain the drugs by any means. A tendency to increase the dose of drug. Fourth, physical and psychological dependence on the drugs and harmful effect to the individual and also society. This is the characteristics of drug dependence patients. It's having a in drug dependence patient into having that's overpowering, desiring to take the drugs, a tendency to obtain the drugs by any means, how it can handle any one condition, a tendency to increase the dose. This person or this patient having a increases the dose, physical and psychologically dependence on the drugs, physical body and mentally having condition is depend on the drugs and harmful effect to that individual persons and also society. Then next, drug abuse can be classified as follows. The drug abuse, drug addiction, how the drugs are the performed with this category of drug abuse or classification of the drug abuse drugs. Like first class, there are the three class. In that first class, permissive or present in common beverages. Then first, caffeine present in tea, coffee and cold drinks. These also are the drug abuse drugs. Caffeine present in tea, coffee and cold drinks. Second example, nicotine. Nicotine in a different forms like smoking, chewing and intranasal administrations. And third is the drug is the alcoholic drinks. These are the drug abuse classification first. These are present in common beverages. First caffeine, second is nicotine and third is alcoholic drinks. These are the present in common beverages or these are the drug abuse drugs. Second classification, prescription drugs. Prescription drugs means these are the drugs is written by registered medical practitioners to patient or to person for the therapeutic use or therapeutic purpose. Prescription is written by doctor or registered medical practitioner two purpose for the therapeutic effects. The drugs which are used in therapeutics for their central effect may leading to abuse, but increasing the dose or increasing that having a drug or administration to leading to that abuse. This drug having abuse, this drug administration is well known. Then example for prescription drugs like opiate analgesics like morphine and pethidine, barbiturates, tranquilizers, and amphetamines. These routinely prescribed agents can also be misused. These are the drugs are used in the for therapeutic purpose, but it's having a misuse also of these drugs like morphine, pethidine, barbiturates, tranquilizers, and amphetamine. These are the drugs also having a misuse. These are second class of abused drugs, prescription drugs. Then third आहे prescriptions or ban drugs. It's a drug having a banning drugs in the India. So first is heroin. Heroin Heroin is a white powder with bitter taste as used for its euphoric effect. Heroin, these are the drugs which having a present in white powders with bitter taste and as used for its euphoric effect. Euphoric means 100 times excitement. Heroin is a highly addictive drug and is derived from the this heroin is derived from the morphine alkaloid found in the opium plant, opium poppy plant. Heroin is derived from the morphine alkaloid found in the opium poppy plant. It is usually injected, smoking, or snorted up to the nose. These are having an administration purpose of this heroin. There are the many administration way that's having a firstly injected, smoking, or snorted up to the nose. These are administration way of this heroin. Second, then ban drug cocaine. Cocaine, also known as a coke, is a strong stimulant most frequently used as recreational drugs. It is a commonly snorted, inhale, or smoke or dissolve and injected into vein. This is the administration route of cocaine. There are the various many route of cocaine administration like a snorted into the nose, inhalation by using nose, as small or dissolve and injected into the vein. Mental effect like intense feeling of happiness, loss of contact with reality or agitation. This is the mental effect are produced by this cocaine drug administration, including that intense feeling of happiness, loss of contact with reality. Loss of reality within this drug is administration and agitation. Cocaine drug, it's made from the leaves of the coca plant native to South America. And another example is ganja, fourth example is charas, and fifth example is the lysergic acid diethylamide. These are the lysergic acid, it is also known as colloquially as a acid. These drugs are the hallucinogenic drug. Effect typically including alter the thoughts feeling and awareness of one's surrounding. These drugs are administration of this lysergic acid diethylamide is typically including alter the thoughts feeling and awareness of one's surrounding. This is the drug in world's highly prized drug. Like that name is that lysergic acid diethylamide. It's a highly prized of drug in the world or in the chemical listed. These are the drugs of this classification of drug abuse classification. Then second, opium alkaloids. Opium alkaloids containing morphine is frequently used to relieve pain. Morphine is having use for the relieving the moderate and severe pain. So addiction is common with these drugs. Addiction is common with this drug. It produces both psychic and physical dependence. It produces having both and physical dependence. The withdrawal symptoms of morphine. This morphine having a stoppage or withdrawal of this drug are the restlessness, vomiting and sweating, etc. This drug having a stop to administration, this morphine having symptoms like restlessness, vomiting and sweating. Heroin and pethidine are other narcotic analgesics which produces addictions. Addiction to this drug is treated by gradually withdrawing the drugs. This addiction of this drug is treated by do not suddenly withdrawing the drugs. It's having a gradually withdrawing the drugs. We have that treatment of drug addiction of the opium alkaloid. Hypnotic like barbiturates may be administration. Hypnotic drugs like barbiturate drug may be administered during withdrawal phase. Occupational therapy and psychotherapy can also be given to this patient by withdrawing the narcotics drug or withdrawing this drug. They are using for the occupational and psychotherapy can also be given to that person or that patient. This is all over the about opium alkaloids. Second, next slide, cannabis indica. Cannabis indica, it is used in the form of cigarettes. It is also introduced into sweet and tea. It produces a dreamy state of altered consciousness. It produces a dreamy state of altered consciousness. The addicts sometimes commit criminal act under its influence, and cannabis does not have any medical use. This cannabis drugs, it does not have any medical use. The next slide, cocaine. Cocaine addicts use cocaine in the form of snuffs or injections. Cocaine addiction use cocaine in the form of snuffs, injection, snorted into the nose, smoking, or dissolved and injected into the veins. Addiction is due to addiction. How that cocaine are addiction? Because it's due to the alertness, euphoria, and reduction in fatigue and produced by cocaine. This cocaine drug administration to patient or person because it's due to it's having that alertness, euphoria, 100 times excitement with this state and reduction in fatigue with normal or working day produced by this cocaine drug, and this drug having administration in regularly and that's having addicted drugs that's named cocaine. Next slide, other drugs of addiction. A variety of other drugs like mescaline, lysergic acid diethylamide, barbiturates, amphetamine, it is also having a stimulant drugs, chloral hydrate, alcohol, etc. are capable of producing addictions. These are drugs are producing the addictions like drugs like mescaline, lysergic acid diethylamide, in short form LSD, barbiturates, amphetamine, chloral hydrate and alcohol, all of these drugs having a producing the addiction. Then next slide, last, drug habituation. It's also having a condition, drug habituation. Drug habituation is a condition which occurring due to repeated administration of drugs. Because the drug habituation is a condition which occurs this having a occurring of this condition because that having a due to repeated administration of drugs. The drug having a dose of the drug, it's having a repeated administration of the drug to that patient, and that's called as this condition called as a drug habituation. Its characteristics are only a desire, not a compulsion to the drugs for its euphoric effect. No tendency to increase the dose, only psychic but no physical dependence on the drug. And it's a harmful effect, if any, only to the individual and not to the society. Its harmful effect, if any, only to the individual. This drug having administration to the person is having harmful effect to that individual person, not to the society. These are the characteristics of drug habituation. Drug habituation meaning that it is a condition which having occurring due to repeated administration of drug. It's having repeatedly administration of the drugs. And the common agent which produces habitation are nicotine. The common agent which produce habitation are nicotine and beverages like coffee and tea. These are the drug habitation agent or the drug habitation drugs. Like agents which produce habitation are nicotine and beverages like coffee and tea. These are all over about the drug addiction, drug habituation, and drug abuse. Are you sure up to here? So next point upload in next lecture. Thank you. Thank you so much.